I've been a registered nurse in California for 13 years. I've worked in nursing facilities, skilled nursing, home health, ortho neuro, some dialysis, and then now I'm in the ER and I'm loving it. I've been an ER nurse for 6 years, going on 7 this year. So this video is really for nursing students who's doing their clinical in the ER because I know it's overwhelming because I taught I've been a clinical instructor before too, so I know. So anyway, number one tip, I have seven for you guys today, but number one, please come prepared. I know it's no brainer, but hopefully you get a good night's sleep before, doing your clinicals. Have your pen or pen light, share, and your stethoscope with you. Make sure you have it ready in your pocket, okay? And then number two, make use of your initiative. So once you hit the floor after getting report from the night shift, ask your nurse, like, where is the patient's bathroom? Where is the call light? How can I turn off the call light? Where is the warm blanket? Where can I get MS's bag? Where is the supply room? Where is the dirty utility? Things like that can really help the nurse a lot, especially if you're gonna be um, staying there for 12 hours. Oh, and then also, how can I get to the lab? Just so if there's any specimen that needs to go to the lab, at least you can help your nurse and you can take it by yourself. Number three, so if you have to start an IV or a line and you didn't get it the first time, please don't beat yourself up. I've been doing it like what I said for 13 years. I mean, it takes a lot of practice, expertise, and patience um, to get it. And if you don't get it the first time, the second time, learn from it and move on. And then my number four, um, we get codes in the ER. So make sure you practice compressions. Hopefully, like, the night before, or at least do 30 compressions before coming to the ER. Just because you'll never know if it's your turn to do compression. So know your patient's code or and you know compression. Practice your compression before coming to the ER. So we had this student. It was the student wasn't assigned to me. It was assigned patient. Sorry, the student was assigned to my coworker, and then the student was doing CPR, and then the doctor had to tell the student to step back and have someone else do it, just because the student wasn't doing quality compression and things like that. So just be prepared. And then number five, focus on your patients, not on your care plans. I've seen a lot of students doing this in the past, and they're just too focused on completing their care plans. I get it. You're supposed to submit it the next day, but then at the same time, you should know your priority, and your priority at that time is your patient. So focus on your patient, know your priority, and prioritize it. And then number six, be confident. They say fake it until you make it. So if you have to start an IV or about to give an IM medication, um, let me make sure that my microphone is working. Yes, it is. So if you're about to give IM or IV, and if the patient asks you, hey, are you good at this or have you done this before? Just say, I'm a student, I'm good at this, you know? Just fake it until you make it. And then number seven, I think this is my last one. I think it's my favorite too. So instead of saying, oh my gosh, I am so nervous, it's my first time in the ER, this is too overwhelming, da 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 da. Instead of saying negative, thoughts or things, just say, I'm very excited. I mean, oh my gosh, I'm excited today. I'm excited to see my patients. This is my first time doing IV start, but I'm here to learn. So yeah, I'm very excited. So yeah, hopefully you got something from this video. If you have any content suggestions, any any questions, just comment down on the comment section below, and I'll see you in my next vlog. And yeah, you guys take care. Bye. God bless.